turn, tip, back this way. Okay, good, all right. Hey everyone, Dr. Todd, and this is Emily from Gonstead Spine Wellness. We're here on a Saturday doing a training. We decided to record this so that if this is helpful for the public or for other chiropractors, you would have what we're doing on a Saturday morning for a couple hours. So Emily currently does traction, and we're gonna go through some postural corrective exercise training and explain some of the concepts behind it. Before we get started, make sure that you subscribe to our channel, like, comment, share, and get this out to other people that you think this would be helpful for. And with the comment thing, please comment, put a comment below. That helps us tremendously. It helps get more exposure to our channel, and then more people can see these videos, and it helps more people, so that's great. So please do that. And understand we serve two different audiences. One is patients, people out there that want to learn about natural health and healing. We have a clinic here in Meridian, Idaho. We have patients that are here locally. We have patients that come in from out of state. You know some of them. And we also take care of chiropractors. We teach chiropractors how to put corrective exercise and functional movement into their chiropractic practice. That's called MoveNowU. So check out the links for both of those below respectively. And the last thing that I'll say is that the stuff we're going to cover today as far as posture is actually stuff that we learned from a technique called chiropractic biophysics. We are not teaching chiropractic biophysics. That's something that we don't do. They do that. They have excellent seminars. I would highly recommend checking them out if you are a chiropractor. Go to idealspine.com. We have the link here below as well. They have individual seminars. They have week-long seminars. They do that out here in Idaho. They travel around the country. They have a bunch of online stuff. But if you're a chiropractor and you want to really learn this, check out chiropractic biophysics. That's where I got exposed to it. It changed my path in chiropractic, opened up my eyes to what is possible as far as helping patients to a whole new level. We do this in conjunction with Gonstead. So we do Gonstead for the segmental adjusting, chiropractic biophysics for curve and posture correction, and then functional movement, which is the big thing that we teach all these other chiropractors. The functional movement piece, which Emily's learning right now, the functional movement piece, she's been diving in, doing this, doing weekend trainings and after normal hours.
After work.
That's right.
I can get it.
That's right. And so we're here Saturday morning going through another piece, which is the postural corrective exercise part and just understanding posture. So with that said, let's get started. All right, we're over here at the dry erase board. I wanted to show Emily something first. I think this is the easiest way to understand what we're even talking about. So I drew my really awful Saturday morning stick figure here. I can draw better than this. I draw a lot for patients and this is not my best. But let's say that this is someone's right. This is their left, so they're looking at us. Put a little nose and face on it so we can see. Okay, so the person's looking straight at us. Now, when we're talking about the main posture stuff that we're gonna cover today, which is the major stuff that we cover with most patients, just to keep it simple right now, we're gonna talk about head shift and rib cage shift, and everything is in comparison to the section below it. So for example, we have head, we have thoracic or rib cage, we have pelvis, and then we have feet, okay? And so we're always comparing how something is moving compared to the section below it. So if we're looking at this plane, which is, looking at someone from the front versus when we look at someone from the side, so now that's someone from the side view, this is the front, this is the back. In that type of thing, it's also looking at head, rib cage, or thoracic, pelvic, and the feet. And we're talking about now someone going forward or backwards on that view, okay? That's a lot of the stuff you deal with traction. I know in traction you're doing like head shifting and thoracic shifting as well, or translation is the fancy word for it. But here, what we'll talk about first is the most common postural corrective exercises. We're gonna talk about head shift. So the head can shift to the right compared to the rib cage. That's not something you have to figure out as far as if the person has it. That's going to be identified by the doctor. That's written on the rec card. You know the person now has a right head shift. Their x-ray might look like this, where it comes over to the side. Okay? And now if the person's posture is shifted to the right, we have to shift them back to the left. The reason for that, like you were talking about before we started rolling, was to shift them opposite direction and hope that they kind of end up in the middle. Part of it is because there's deep ligament and disc and deep muscle that gets almost like deformed into this misaligned position. So if someone shifted like this to the right, usually their left shoulder will elevate. That's a common thing too, is that when they shift this way, most of the time the opposite shoulder lifts up, okay? Sometimes when someone's had lots of trauma and it's a really messed up injury, they'll be shifted and their right shoulder shrugged up, and you're like, why is that happening? That doesn't really match. And that's like an unmatched posture. So if someone's shifted and that left shoulder elevates, muscular wise, there's gonna be a big asymmetry in their trapezius and their levator scapula and their scalene muscles. It's gonna be very different from side to side, and it's gonna be harder for them to be able to shift back to the left than it is for you. So if you're demonstrating, it might be easier. And then when they try to do it, it's so hard because they have that posture. They're stuck in that position. Yeah. And that's something that's important to communicate to the patient as well, is say, look, I'm doing it because I've practiced it, and I may not have the same postural problem that you have. You do have it, so it's gonna be even harder for you. So giving people that encouragement when they can't seem to get the coordination down, or when they have so much tissue problem, tension, yeah, exactly. So shifting this way, in a lot of cases, if someone's stuck to the right, this tissue here is gonna be more shortened. Okay, and it's gonna be harder to come over. So that's where, from a standpoint of like their warm-ups as well, like if you're instructing someone on postural corrective exercise and they're really struggling, you can even just ask them, does it feel tight on this side? Like the side that they're trying to shift away from? Oh yeah, it is. Neck trigger point tool, J cane, double across ball.
That's why we ask them when we're doing the move all 3 assessments, like which side is tighter, and we can kind of tell.
Yeah, well, that, and just, I'm pulling this over here. Like sequence one, this is a warm up. We have 3 sequences. We have sequence 1, which is cervical, primarily cervical and upper thoracic. Sequence 2 is thoracic, rib cage, and then
back.
Yep, and sequence 3 is like low back, lumbopelvic. So this is sequence 1. This is something now that person's going to ideally do before they do their postural corrective exercise. So this answers the question, should they do their postural corrective exercise first or their sequence 1 warm up?
Sequence 1 warm up.
That's right. Okay, and now you know why, right? So if a patient asks that, you know the reason. It's like, get the tissues calmed down a little bit, stretched out, improve mobility before you start to do an exercise that maybe you have restriction and it's hard to do. So if they're shifted to the right, the main thing that we want to do is instruct them how to shift back to the left. When we're shifting them, common errors people make is, so they're shifted right, they have to go left, is instead of just shifting straight over to the side, they're gonna rotate their head, so their nose is gonna come off center. They're gonna rotate this way. They're gonna laterally bend like this. So all of those things are the cues that you have to watch for them. A good analogy or a good cue verbally that you can tell them is say, imagine that there's a string going through your ears and you're moving along that string, okay? Because if that's the case, you know, you can't turn, you can't laterally bend, right? You have to just move along the string. And then that's why they're doing it in the mirror. Okay, so this is the setup. You want to have some kind of sturdy object. Some people just do this against a wall, but we use these against these frames. Normally you'd be facing the mirror. So if you want first, you can face the mirror, and I'll just stand here and I'll coach you through it. From there, you're looking at yourself in the mirror. Now here's a couple things you want to make sure you're doing. Make sure that the rest of your body is in good alignment when you're doing this. So make sure like your feet aren't off to the right and you're shifting like this. So yep, so get your pelvis centered over your feet. And these are nice things to teach a patient, is to say, get everything else lined up when you're doing this. So we're assuming that your head is shifted to the right and we have to shift you to the left. So your shoulder is blocked here. Step a little bit more forward just so you don't flip this block over. Another thing before you get started, in most cases, if the head is shifted right, the rest of that left shoulder is elevated. To do this more correctly, if their shoulder is elevated, guess what they should do with that shoulder when they're doing the exercise?
They need to bring it down more than they would this
Exactly. They want to depress that shoulder down, and doing that puts this on stretch to begin with too. So let's just do that. Drive that shoulder down like you're reaching down to the floor, but try not to bend your spine here when you're doing it. All right, so drive that hand down like you're reaching, but keep this level. And last thing, I know there's a lot here. Last thing on this side view, I'm going to show here for the camera. On the side view, when you're doing it, if someone has a forward head position or a slouchy position like this, get them upright. Correct their sagittal alignment. Get them real upright before they start this exercise. So fix the other plane. So say, okay, let's get the shoulders back. Put your scapula in your back pocket. So retract and depress your shoulders. Pretend that you have a little hook here on the chest, lifting you up. Get nice and tall. Don't flare out your ribs. Contract your core a little bit. It's like a lot to think of, right? So all of those things, now you're in a good sagittal posture, good side view posture, then stretch that shoulder down. Good. I'm showing you all the specifics. Normally I'd layer this on, but the fact that we're recording this and that the rest of our team can watch it and everyone else out in the world can watch it, this will be a helpful, all-inclusive, how I like to instruct it. So, and then from there, you're gonna shift your head to left. as far as you can. You can pretend you have a string going through your ears. Keep your nose center. It almost will feel like you're turning your head to the right as you're shifting to the left to keep your nose center. So try that again. Okay, good. So it's 2 seconds into the movement, hold for 3 seconds, 2 seconds out. And then each rep, you have a patient reset their posture if they start to lose something. So make everyone as good as you possibly can. If someone's struggling with this, which a lot of people will, I wouldn't get this nitpicky on the first couple of visits. You want them to have this down to a pretty good understanding before they progress to the next step, which the next step is doing it against resistance. Okay, so how you think about this is any sort of resistance, you want the resistance to pull you further into your bad posture, okay, so that you have to resist it, right? So if you have a right head shift, you got to pull further to the right and make yourself worse, and you have to fight it, essentially, okay? So it's going to go on the right side of the head. So here's how we have this set up. We have this vertical post here. We have this little D-ring here that we flipped on a Slastix band. So you latch on here. So now just slowly step to the right. And normally you would have the advantage of having a mirror to look at. You don't have a mirror right now, but you're helping demonstrate to the world. So I'm gonna watch you and I'm gonna give you some feedback. So do you feel any resistance right now?
Yeah, I do.
Okay, so just try from right there then. Now granted, this is after a patient's already done this against a post. They have the feedback. What I'm gonna do is I'm gonna take my hands and I'm gonna show you how I want your head to be turned or tipped. And it'll make sense. Most patients get this, okay? So start to shift your head. Okay, so turn, there you go, and then tip, turn, good. And then come back to neutral. And try not to rotate your rib cage either. So try to keep that neutral, drive that shoulder, that arm down, a little bit rotated. Okay, good. Yeah, that looks good. Okay, so try shifting, turn, tip, back this way. So this is perfect for you since you have a right head translation, so you can practice this. We haven't really progressed you where you've gotten your static ones down to doing against resistance. Yep, but this is what you do. Like it should be this specific. If you see someone early on doing this, there's all kinds of stuff you can clean up with them. And people appreciate it because they want to do it better and better. And so if you're a patient watching this, these are some cues of what you're probably doing wrong. So make sure you're watching yourself in the mirror and you're aware of not tipping, rotating, unless you're supposed to. In some cases, I'm showing you a very basic postural problem, just a pure right head shift. You're shifting it to the left. Sometimes people will be shifted to the right and laterally flexed. And if that's the case, they need to shift to the left and laterally bend. Okay, so that's different. Sometimes people will be shifted to the right and left rotated. They'll have to shift to the left and right rotate. So you're doing the opposite of what you have. Right now, this is only one postural vector that you are correcting, which is a head shift. Most cases, to keep it simple with a patient, we work on singles or doubles, but we get to it once they can get this down. We'll start with like a single movement first. And then if we need to teach them a double, that's after they've mastered the single, because most of the time it's hard enough to learn this. Okay. The next step, like the third tier of this, is where you have to use a longer one of these, because the little short one's not going to work for this. The third one is now with a functional movement. Okay, so now in this position here, you have this anchor point that's straight across. So step a little bit to the right so you just feel a little bit of resistance trying to pull you to the right. Is that enough resistance already? Okay, so then you're watching yourself in a mirror, and now what I want you to do is maintain neutral. So in this case, you're not trying to shift your head to the left, you're just trying to hold it neutral, okay? So it's a little bit of engagement. You can already feel that engagement right now just standing there. And now from here, try to see if you can do like a little mini squat. So like get your legs a little wider, go down and do a little squat and try to hold your head and neck in that same spot. Okay, cool. And then try to do maybe like a backward lunge if you're comfortable doing that. So do a backward lunge. Okay, step back further, get like a little wider stance. There you go. Cool. Not too bad. All right, come on up. And the whole time you're maintaining, holding your head neutral. All right, and then you lunge back with the other leg.
It takes some thought to
It does, right? Okay. And then you could also do like a forward lunge. So there's all kinds of stuff you can do here. And keep in mind, a patient is going to have a timer set. And they can now do this for a set number of minutes. So it's not repetition, it's not speeding through it, it's nice and slow and controlled, and they're resetting themselves each time. This is as much of a muscular connection as a neuromuscular connection, meaning just getting their brain to understand, oh, when I go through movement, this is where my posture should be when I'm going through movement. So this is adding a functional movement component to it. They can also, if they can't lunge or do lower body stuff, something you can do that also works. You ever use this?
No, I've never seen that before.
Okay, so watch, hold it right in the center. Yeah, you can hold it with one hand if you want, and hold it where the blade's facing this direction, and then take your arm and move it back and forth. See how it vibrates? Okay, and it moves and it shakes and it makes you want to stabilize. And the whole time, try to keep your neck neutral. And then remember, fix your sagittal posture. So get your shoulders back, tuck your chin back a little bit, stand real high, chin up a little bit too. So that can conclude the training for the simple neck posture right now, as far as postural corrective exercise. Let's move on to thoracic. All right, so now that we covered a lot of the stuff with the neck, let's cover rib cage, thoracic. Let's pretend their rib cage is shifted to the right, okay? So if that's shifted to the right, that's their posture. These are the two most common. We'll get to maybe a sagittal posture too on the side view if we have time, but hopefully this will just give you some concepts and at least open up the conversation. Okay, so if they have a right shift, we're obviously gonna be going the other way. So that's the exercise. Got it. And it's rib cage shifted compared to pelvis. Remember, it's always the area we're exercising is always compared to the foundation.
Gotcha.
So it's not shifting the rib cage in comparison to the head. It's, if they're shifted, it means now their head and their rib cage is shifted compared to the pelvis. Okay? Yeah. Because sometimes, a lot of times, they're shifted and their head shifted this way. So if that's the case, we have to shift this back, and you want them to try to shift the head the opposite direction.
Yeah.
Okay. It starts to get a little more complicated as far as the coordination for a patient. That's why we usually work on one posture at a time.
Yeah.
They get that down, then you can start combining things. Let's talk about the thoracic one. So let's go over here. Make sure, I'm gonna check you from the back, and you can see yourself in the mirror too, but bring your left foot to the left a little bit. Most people have a tendency of standing a little bit too far to the right with their feet, and their pelvis is to the left of their feet. So now what you're gonna do, you can put your hands across your chest, okay? And then this one, now the cue is you pretend that there's a rope or a wire going through your shoulder, coming out your other shoulder, and you're moving along that wire. Perfect, cool. And you shift as far as you can possibly go without compromising anything else. A lot of people have a tendency of doing this. They'll shift and they'll compensate by moving their head this way, which you don't want them to do. Okay, so we're gonna shift 2 seconds in, hold for 3 seconds. And if you wanna make this even that much better, slight contraction to your glutes. So turn on your glutes, pull up your kneecaps, so contract your quads. So everything is engaged. You know, really be. And that carries over into the functional movement stuff where we're always cueing patients to turn on glutes, quads, pull the kneecaps up. It's more of like the kettlebell work. You can totally throw that in here when you're doing postural corrective exercises. Now, the next evolution of this, because I think you got this part down, we use a harness like this. A rib strap, same idea here, where if you strap them too high, okay, so if it's up here, you just have to make sure that the anchor point is straight across. Because if it's up high or down low, it's going to engage some other motion, just like it was with the head. Mm-hmm. All right, so arms across your chest. Correct your sagittal posture first, so get your shoulders back and down. So like pull your shoulders back, pull your scapula into your back pockets, and engage the core slightly, so don't flare your rib cage up and don't have the head forward. So you fix all those things, and then you say, now I'm ready to shift. So then shift straight across. So here's what happened immediately. Now that we added resistance, your shift looks like this, looks like a lateral bend. It doesn't look like a pure translation anymore. So try to shift straight across. So I can help you a little bit and say, now fix that. Get your shoulders totally level. Hold that. Okay, then come back to neutral.
I can feel that as soon as the resistance starts, my shoulder like wants to.
Yep. Try to also make sure you don't bend that left knee, because what you're doing is you're kind of bending that left knee as you're shifting, and then it tips your pelvis down. So you want to keep pelvis level, both your knees either equally bent the same amount or locked, as long as that doesn't bother you. And then you can always add more resistance as it gets easier, and you're going to do this for time. And then once you've mastered that, so you're gonna step over to the left a little bit until you have some resistance, okay? And you can put your arms out in front of you if you wanted to, or however you wanna do it, but keep your shoulders back, try to have nice, good posture. You figure out if you want that right arm in front or behind because now we're going to do like a backward lunge. So try doing a backward lunge and holding that position and not letting your rib cage fail over to the right. And this is a side note for functional movement. The way to make a lunge easier, widen your stance. When you step back, don't step straight in line. So like instead of your right foot going directly behind your left foot, have it go off to the side. There you go. Cool. So that gives you a lot more stability. Yeah. As someone improves and they're trying to work their balance, they can try to lunge forward or backwards more in line. All right, this next part, we're going to talk about the side view. We drew a new picture. This one's a little bit better art-wise, right? A little bit?
Yeah, just a little bit better.
All right, this is the front, this is the back. On the side view here, if we do a plumb line, there's a certain balance that's supposed to happen, not just in the spine, but with body parts. All right, that's what's supposed to happen. That's how people are supposed to balance. The spine is in the healthiest position when you're like this. Now what can happen is a very common one. This comes forward, pelvis rounds under, kind of like a dog scooting its butt on the carpet. Okay, that happens where pelvis rotates under, flattens this out, rib cage comes backwards, head juts forward. No, now they're unhappy because look how nasty that posture is. So now what's happened here? The pelvis has now shifted forward. The rib cage in relation to the pelvis has done what?
Shifted backwards.
Gone backwards. The head in relation to the rib cage has done?
Shifted forwards.
Okay, and this is where it gets like super ninja. The angle of the shin compared to the foot. Has that angle, has it gotten bigger or smaller?
Smaller.
Smaller. Okay, that's gonna be important here in a second. I'll show you why. So that angle has gotten smaller. So now their foot is in what's called a dorsiflexed position in their normal posture. So they're hanging out in more dorsiflexion instead of plantar flexion. Plantar flexion is pointing the toe.
Yeah.
Dorsiflexion is pulling the foot up towards the shin. So this is what we're gonna show you how to reverse that posture. You already understand some of the concepts, but we're gonna refer back to this picture if we need to, because I'm gonna tell you about this foot thing, and that's what will blow your mind a little bit. So this one here, now you're positioned on the edge of the wall. We have the block in between your mid-back, your rib cage. That's creating a space now. So similar to traction, you know, in traction, we put the block there to shift the rib cage forward compared to the pelvis. So you remember in that picture over there, is the pelvis behind the feet or in front of the feet in that abnormal posture?
It's in front of the feet.
It's in front of the feet. So if the pelvis is in front of the feet, how do we put the pelvis behind the feet here?
We're gonna tuck our butt back.
And what else can we do with the feet to exaggerate that?
You can bring your feet out more.
Yes. So if we put our feet forward more, it changes that relationship of pelvis to feet. Because remember, in this position, the pelvis is in front of the feet.
Yeah.
In this position,
Or pelvis is behind.
it's behind and the wall holds you there from falling over.
Yep.
Like I just fell over trying to show you that. Okay, so walk your feet forward even more. Right there. Lock your knees a little more if you can comfortably. And then get your pelvis pushed against the wall. All right. And then this creates a space here. That's pretty easy for you. Pull your shoulders back. Now here's another piece to this. When people are in this position, more times than not, their arms, are these turned out or turned in?
Turned in.
So turned in right now in my abnormal posture.
We want them
Turned out.
kind of like the anatomical position. We want them.
Exactly. It's all making sense now, all these little specifics. All right, so now they lock their knees and push your pelvis into the wall. So push through your toes, contract your calves, and you can even lift your heels up a little bit and you can plantar flex. You can plantar flex. Why are we plantar flexing?
Because we're fixing, because if their feet are naturally like this, we want them to start.
Right, because their posture is they're dorsiflexed.
Yeah. That's like stretch as is, like by
Yeah.
itself.
So like everything we're reversing, right? The very first time you show this to a patient, I'm not going to go through all this detail. I'm going to be like, put your feet there, put there, there's a block, and see if you can get in the position. And then after they can do that, then I'm going to fine tune each. I'm going to add one thing, make sure they get it. Cool, not overwhelming you. Now I'm going to add another thing. Another thing you want to do is you want to tell them push the pelvis into the wall like you're trying to push the wall down. So actually like push hard off your toes, pelvis into the wall. And then externally rotate, pull your shoulders back, and then try to drive your head back and touch the wall if you can. And then they're going to hold that position for 3 seconds.
Yeah.
2 seconds in, 3 seconds, 2 seconds out. And they're going to do repetitions. They're going to do it for time though, but they're going to go through reps doing this. They're going to reset themselves. They're going to take a breather if they need to.
So if someone has pain when doing this, so like when we're going back, because there is such a large gap between their low back,
Yeah,
what
smaller.
modification could you do? 'Cause
Smaller block.
Smaller block.
So use a smaller block. And another thing is most of the time when someone's shifted backwards like this, most of the time the pelvis rocks under like this. So when they're in this position and they're pulling their pelvis back, if they rock their pelvis forward more as they're doing it, that's why it's hurting their low back, is because they're allowing their pelvis to rock forward. So here, I'll show you instead of telling you with words. So try this, go back into the same position. As you push backwards, try to now do this with your pelvis a little bit. Try not to bend your knees as you do it, but try to flatten out your low back into the wall. We use that as a cue. It's subtle, but sometimes that's enough to not increase the pelvic tilt.
Mm-hmm.
Okay.
That helped a lot.
Okay, yeah. So it's like as you do this, now you, so you're
you have to tighten your core to like, be able to push back even more.
But all those little cues are things people aren't going to think of. So let me see if I can do this where you can visually see it. So if I'm here and I want to increase this, you have to, I'm just tilting this back a little bit.
Still...
Yeah, so I'm tilting this back and engaging your core. Yeah, definitely you engage your core when you do it. Something else that you can go through with the patient is when we're instructing on posture, we talk about put your thumbs on your ribs, okay? Put your middle finger on the top of this bone here, which is the crest of the ilium. And then I want you to tighten a little bit and see how this pinches down. And then I want you to pull your shoulders back and up without increasing the distance between your thumb and your middle finger. So essentially what it's trying to do is trying to teach someone that this is a cylinder that stays locked in place, and you don't want to lose that core engagement when you go into another position. People that try to stand upright, or when people get into kettlebell movements, a lot of times what they'll do, like they get into a hip hinge, they'll do this. And they'll increase this, and this will flare open, which is what we don't want to have happen. When they go into this position, this wants to stay locked. It doesn't move. Versus, okay?
Yeah.
So the thumb in this is a good cue for people to realize there's a set distance between the rib and the pelvis. Maintain that distance through all of your movements. This carries a lot more into the kettlebell work. When you're doing deadlift, when you're doing a swing, when you're doing hip hinge movement, that's a way to cue someone to understand that they're increasing their pelvic tilt, or they're keeping this neutral and they're engaging their core, because technically engaging these muscles is what prevents this from opening up.
Yeah.
So when someone has a weak core and a lack of engagement, this opens up easily. All right, there you have it. That is a Saturday morning posture training. Did you get a lot out of that?
I did, a lot.
Awesome. There's more to come. This is something we did internally for our own team. We figured we'd share some of this footage with you out there. We cut out a lot of the details because we didn't want to make this video as long as it took us to film it, which was about an hour and a half. You're seeing a much edited down version on your end. But as you can see, there's a lot of details that go into the exercise process, into posture. We look at posture very specifically. Just like I said in the beginning, to learn more about that, check out Chiropractic Biophysics. To get this sort of well-rounded approach, you can come visit us at our clinic out here in Meridian, Idaho, to learn the functional movement aspect, which we didn't even cover in this video, but the functional movement aspect of what we teach other chiropractors. That's MoveNow University. Check out the link below. And when it comes to the health of you and your family, results matter
Most.